An endodontic abscess is a pocket of pus that forms in the jawbone at the tip of a tooth root. You may realize you have an abscess because the tooth hurts when you tap or bite on it, you have a bad taste in your mouth, or you experience pain and swelling. On the other hand, you may be unaware of an abscess because you have none of these symptoms at all. An endodontic abscess begins when bacteria, which are always present in your mouth, infect the inner pulp layer of the tooth and kill the pulp. The infection can then spread from the pulp chamber, down the root canals, through the tip of the root, and into the jawbone. There the pus builds up and creates a hole in the bone. This hole in the bone is the abscess. Sometimes the abscess drains near the infected tooth, forming a gum boil. Two common causes of infection in the pulp are fractured or broken teeth and deep cavities. Both allow the bacteria to get through the enamel and dentin layers of the tooth and into the pulp. Sometimes a blow to the tooth allows bacteria to enter the pulp. In some cases, there is no apparent cause. The abscess creates pressure inside the bone and ligaments surrounding the tooth and can cause excruciating pain. Left untreated, an endodontic abscess can damage the adjacent soft tissue, lead to bone loss, be a continuing source of infection that drags down your immune system, and even be life-threatening. To find an endodontic abscess, we perform a thorough examination, including X-rays. On an X-ray film, a dark area at the root tip indicates an endodontic abscess. We may also use an electric pulp tester to determine whether the pulp is inflamed or infected. An infected tooth will never heal on its own. Because root canal therapy removes the infection, it usually heals the abscess too. Sometimes, however, even after a root canal, the infection continues to grow. In that case, retreating the tooth with root canal therapy or a further surgical procedure called an apicoectomy will stop the infection and restore the health of your tooth. An endodontic abscess is painful and can lead to much more serious conditions. It should be treated right away to maintain a healthy mouth and body.